In this module, we look at another country and how social welfare policies are linked to political order and how social welfare policies have helped social control. So we look at the experience of New Zealand. So New Zealand was ahead of Britain in terms of social welfare policies. By 1938, New Zealand has established, as one commentator said, the most comprehensive social welfare system in the world. And some of the social security benefits which New Zealanders were given in after 1938 during all these years was child disability allowance, where if you take care of a child which is disabled, you are given allowance. Then job seeker support, which is mainly unemployment insurance. Then New Zealand superannuation, which is pensions, old age pensions. Orphan benefit scheme, which is basically taking care of children whose parents are deceased. Sole parent support, or when there's a single parent, then they are also given supported living payments. Again, those people who are disabled or who have been disabled, they are given support by the government. Unsupported child benefit, meaning thereby people who are taking care of the children who are by various reasons cannot be taken care of by parents, then they are given benefit. Veterans pension, which is linked to people who have worked in security services or army or air force and who now are disabled and cannot work, so they are given pension. Then young parents payment, meaning thereby siblings or other people who are not yet adults but they are taking care of children who need their help. And then youth payment scheme, which is that young people who are not yet 18 but they are not living with their parents, so they need help to survive and they are supported by the government. So all these different schemes were part of the New Zealand social welfare system. And when the initial test started, the benefits increased, more and more new schemes were introduced and all that. But in the 1990s, there was, and this of course brought political order and stability, but in the 1990s, views changed. Both major political parties decided that this is not the way to go. The New Zealand finances can't provide for all these people, so they started cutbacks, and there were drastic cutbacks. So there was less funding, more mean tests. So mean tests are tests which are introduced to limit the social welfare payments, meaning thereby that if you want a certain payment, you have to come and government will test that whether you have other means to survive or not, or there are certain conditions you have to fulfill. So if you claim to be disabled, you have to come and doctors and nurses will check whether you are really disabled or just faking it. So these are the different tests which are introduced. Then there were user-based charges, meaning thereby that previously health was free, and then of course when you visited after 1990s a hospital or asked for a medical help, you have to pay a certain portion of the expenditure on you, which may be 5%, 10%, or even 20%. Then there are of course less staff, so you have to wait for the doctors, for the nurses, for the engineers, for the help. Help will not be given to you immediately. And then of course there was less housing. But again, after 1938, social policies helped stabilize but even after 1990s, there was no, even when the services was drastically reduced, there was not much violence or disorder in New Zealand. So again, the link between social policies and social order is tenuous at best. So, and there are other factors on which political order survives. So what are these other factors? So other factors are history of conflict. So some countries have more conflict than others. So if we look at the history of France and New Zealand, compare it, or we compare the history of US and Switzerland, Switzerland has over the last 2 or 3 centuries much less conflict, and New Zealand has much less conflict as compared to US or as compared to France. Then the level of development, more development means that less and more awareness means less conflict usually. Then gradual removal also helps. Type of society, if the society is more apt to question the government, then there will be more conflict. Then of course, if the society is multi-ethnic, religious, linguistic, more conflicts happen. Poverty levels inflict. Leadership also affects the political order, political stability. Availability of arms and ammunition also affects political stability. Some countries, like for example Pakistan and United States, the arms are easily available, and so whenever there is a conflict, there is much more loss of life as compared to in countries like Britain, where these arms are not freely available. Police effectiveness also affects the political order. Even when there is a conflict, if police is effective and efficient, there will be less damage to property, there will be less loss of lives as compared to in developing countries where there are more deaths and more loss of life and more conflict. So all these factors affect the link between social policies and political order, not only the social welfare policies.